Good afternoon. My name is Martha Nowak, and on behalf of Kansas State University in Olathe, I want to welcome you to this virtual veterinary medicine cases and careers in veterinary medicine. We have quite a few who've chosen to join us today. So if you are not familiar with Zoom protocol, once I have seen your face, thank you very much. But because we have close to 50 people in on this, probably would be a good idea at this time to turn your camera off and keep your microphone muted. You may use the chat box at any time to send a question to me. I'll moderate at the end of the presenter's lecture. So if you want to correspond in that way, that would be entirely appropriate. This session is being recorded. It will be put on the website as soon as I can arrange for the editing to take place and get our communications people up on that. But it is my great pleasure to introduce to you Dr. Matt Mieser.
I'm not the only one that doesn't have food in here. No, I'm gonna go in my room.
You'll need to mute your microphone, please. Thank you. Dr. Mieser is a clinical associate professor and section head for livestock services at the College of Veterinary Medicine in Manhattan at Kansas State University. So he has prepared videos and all kinds of content that are going to stretch our brain muscles. If you guys will pay attention for approximately 45 minutes, we'll open it up to questions and answers after that time. So if you'll make sure once again, your video is off and your microphone is off, I will now turn this over to Dr. Mieser, who will share his screen and get going with that presentation.
Great, thank you all for showing up. And I just want to, we tested audio earlier. I want to make sure it's still good, right, Martha?
Yes.
Wonderful. So thank you guys so much for allowing me to take the mask off for a while. So it's nice to be able to breathe every now and then. So we have a fun case today. It's a common problem that we see in mainly dairy cows, but start off with this question, and the way that we diagnose this problem is by listening to a sound that you all have heard, and we will probably in different context. So with that, when I do these, I really kind of like to start with just sort of an introduction as to what I do, mainly to give you guys a chance to understand how some of us get to where we're at teaching at a veterinary hospital, and to sort of give you guys some other ideas on different opportunities as a veterinarian if you decide to go this route. And we all think of our local animal hospital or our local private practitioner veterinarian that we take our pets, cattle, horses, and others to. However, there's a lot of other opportunities, and this is one of them. And quite honestly, my goal was to be the local practitioner that graduates from veterinary school and does all animals. With a series of events and opportunities, I ended up coming back to specialize and teach. But what's really nice about my job here is that see if I can figure this out, is I still get to do a lot of the clinical portion of this. So I still get to be a clinical veterinarian, meaning that I get to treat patients. I have since taken that to a little bit narrowed in that I do almost all livestock. So cattle, sheep, goats, big ones, little ones, and llamas, alpacas, but most of it is going to be an agricultural type animal, very little horses anymore. But I get to do a lot of clinics. And what's even more fun is I get to teach a lot of vet students, house officers, and I spend a lot of time consulting with other veterinarians. So it's a really neat opportunity to branch out and get to do a lot of different things while you teach. And then at the same time, we can we have a burning problem that we want to answer, we can try to do some research and investigate it. My position is such that I do mostly clinical work, and I collaborate a lot. So it's a fun job if you guys are thinking about it, as to thinking of opportunities and ways to do that. Now, it's a little different. There's a few steps you have to do to get back to this type of a position. And so I did the undergraduate work, I did the veterinary school work, and at this point, this is where I went to practice. So I went into a private mixed practice and practiced on small animals, dogs, cats, and all those kind of things, and I really enjoyed that. My wife is also a veterinarian, and her choice was to do specialize more in academia and horses. And so I left practice and followed her to another university at Ohio State, or the Ohio State University, which they like to call it, for another 5 or 6 years. And I ended up going back to school, getting a master's degree and some board certification. And what's neat about board certification is you specialize, you take a lot more exams, a lot more detailed exams. But when you get out, you have a lot of other opportunities. And mine was to stay in academia and teach. And so I taught at Ohio State for a while, and I've been out at Kansas State now for about 15 years. So as you can see, there's opportunities in industry, there's opportunities for research, there's opportunities for private practice in all different species. So some of you guys that have logged on today may have not been aware of that. And I say that because, quite honestly, until I was probably a senior in veterinary school, I really didn't understand the difference between an intern and an extern and a resident, and what it took for my professors to teach me in veterinary school. So I bring those up just to give you guys an idea of another direction to take, and I wouldn't change it for the world. So I get to live a really fun life and get to see a whole bunch of different things. Outside, I seem to feel like I live under a rainbow. So I get to do a lot of fun stuff, see a lot of neat things, get the opportunity to do some really neat cases and other while I'm here, and spend a little bit of time thinking about life on the outside too. So good life, a lot of fun, and just an opportunity. So with that, I say we dig into one of our special cases. Is a patient that was a 4-year-old Holstein cow, so a breed of dairy cow, that had a calf a couple of weeks prior to this. She developed a disease called milk fever and a disease called ketosis. We'll go over both of those in an overview. Both of these lead to a difficulty in the ability to rise. So she has struggle getting up. In these times, in these struggling periods, we always worry that they're going to traumatize their muscles, their joints, their back, and those kind of things. So it's really a nerve-wracking period, and we try to treat them promptly and diagnose them really rapidly. She won't eat very well. Okay, so she will eat some hay. She struggles to get up. It spends most of her time down. She doesn't want to eat grain very well. She appears to just have some rumbles in her tummy. She does not have a severe fever, but does not appear horribly sick, seems to be having trouble getting up. And so these two diseases are a couple that we'll kind of briefly go over as other problems to address before we get into our wondering why she's got this basketball in her belly. All right, so milk fever, okay? I think plenty of you guys in some courses or in some of your experiences in life have heard about milk fever in cattle. Very common disease in dairy breeds. More common, actually, in these breeds. So with that, think back in your mind what breeds we have here, and this is actually a Jersey and a Holstein. So a Jersey cow, a Holstein cow are the two most common ones people recognize. Another couple are Guernsey cattle, and then this one, very few have a recognition of, but this is a brown Swiss. So all of these dairy cows tend to be a little bit more susceptible to these milk fever type disease and versus beef cattle. Not that a beef cow cannot get these, but these tend to be really common in the dairy side. So how does it happen? And the reason they are so susceptible to it is that right before they're getting ready to calve, if this is our blood calcium levels, so a few days ahead of time, this can happen right before calving or 0 day being calving period, you'll notice that she's losing calcium over a period of time before that. And what's happening here is most of this calcium is going into production of colostrum. So that first large amount of milk that she is going to have in her udder to supply in a milking situation is really dropping in her blood levels. Okay, so this happens pretty significantly. It happens more severe in older cows. It happens more severe in Jersey cows than the Holsteins, but it happens in all. So the older the cow, the different breeds it happens. So this is something we expect. Okay, calcium drops. It can get down to a very severe level in that we get clinical disease. But even on the normal dairy cow, you'll see that it drops a little bit. Okay, but these are other magnitudes of drop. So she's building colostrum for into her udder, that first milk that actually has the most immunity in it. It's a metabolic problem. When you're in veterinary school, you learn all about bone metabolism and feed input, the dietary balance that they have to try to manage in these dairy cows. And it's pretty extensive, but a lot of fun. Rapid decline, okay, in the serum calcium. And when you start losing calcium, things start going bad. Okay, so she starts to shiver and shake. You'll find that her ears are cold, her nose gets really dry and doesn't want to sweat. These fall stages, so you'll start to see, I wouldn't expect you to know normals, but these calcium levels are starting to get low here. So being 7.5 to 8 was what we want to stay above. And so she's really starting to drop. And so they go through these stages until they actually get down and can die from this disease. Okay, but they get really a lot weaker. They start to shiver, they start to shake, they start to have convulsions, they get really weak and they can't get up and they don't want to eat. So really depressed, really obvious. The diagnosis, once you've seen a few of these, is quite straightforward. It's something we can diagnose really without having to do blood work. We can usually do it based on clinical signs alone. We can predict it's going to happen in some animals, meaning the older ones, as well as the different breeds, but it can happen in anybody. But regardless, it's one of these that we can diagnose and we treat it. The treatment, replacing calcium. Really is pretty straightforward and a simple thing. The diagnosis and the know what to do is easy. We have to be really cautious about it. So we do have to give them calcium, but we have to be careful about it. So we're really careful and cautious about giving that at a right rate. If we give it too fast, we can potentially stop the heart. So it's one thing that we want to do. We want to replace it quickly, but not too fast to be a complication. Okay, so our cow here, we recognize that she had all the clinical signs of hypocalcemia. Right when she calves, she's having trouble getting up, and so we can replace that. And oftentimes this is something that can be done by a client as well. So I put these as, if we give recommendations, they want to keep them on something solid footing so they don't slip. They want to remove the calf if it's present, keep the cow up so that she doesn't fall over and bloat. Okay, so they can do these things, but quite honestly, most dairy producers can administer this calcium as well, and they do. Okay, but in this situation, we were called out to identify it and treat it. So we give them usually a bottle of calcium while they're laying there. So we can replace that, that's correct. The other thing that we noticed with her is we took a urine sample. And when we took that urine sample, we put it in a dipstick and we saw she had a lot of ketones. And people say, so what are ketones? And what is ketosis? And ketosis is essentially, as she's building that colostrum, making milk, not eating very well, she's having to get energy from somewhere else. And usually that's off the fat of her back. And so she's smells, if you guys, some of you guys will be able to smell it, okay, on their breath. It smells like, some people would say the nail polish remover and other things. That's more of an acetone in my mind, but some people really sensitive say it's really potent like that. But it smells really sweet. It's this really sweet smell when you can smell it. So you can smell it, but the way we do is we test either milk, blood, or urine. And on the urine test, her ketone levels were really high, okay? So reasons for it, either they have an infection sometimes, intestinal upset, indigestion. What's happening is they're not eating enough to produce the milk that she's trying to make. And so her energy level is really down, and we're managing this through fat mobilization. So she can't get it in the front and eat it. So her body's saying, hey, we've got to get it somewhere. So let's take it off the fat stores in our body, mobilize it to the liver. Ketones actually become an energy source. Okay. So you notice this, that these dairy cows, when they are right after calving, their milk production is rising really rapidly. And any cow, even one that's not sick like our patient here, the milk production peaks before they're actually really wanting to eat. Okay, so they don't eat as well as they can have a hard time keeping up with their milk production. So this is a normal process. This is a life-saving process in the normal cow. The problem when it becomes a real problem is when this gets too far. Okay, so we can diagnose this one as well. Okay, so she's taken fat, and when you guys go through chemistry now, or you're in veterinary school, you learn a lot of detailed chemistry that we will ask you to regurgitate on examination. So remember, as you're going through undergraduate and other, to pay attention to your biochemistry and other chemistry classes, because these will show up again. We talk about ATP and all of those things. I have a freshman and a junior in high school, and we have fun discussions around the dinner table on ATP production and energy management. So the Krebs cycle becomes a dinner discussion when you're thinking you're going to veterinary school. So remember all that. It becomes important. But these ketone bodies that are produced in the liver will become an energy source, and it's very important for her. So great, that's wonderful, but sometimes they get too far gone. They still don't want to eat. Okay, so it's easy. Again, it's just another replacement. We can recognize it. We can diagnose this based on her urine ketones, blood ketones, clinical signs, and the treatment is quite straightforward in that we replace the energy demand with dextrose, usually through an intravenous needle and a bottle. And one way we can do that is we just put these bell caps and a needle into it, and we just drain in a bunch of dextrose. Sometimes that works. Sometimes it gets a little bit further where we actually have to put them on an IV drip for a longer period of time. Those are cows that are really down and sick. So our patient here, we actually put her on an IV drip that took about 24 to 48 hours to get her normal. So we're giving her energy through an IV line. Other things we do, okay, we're trying to get all this glucose where it needs to be, and so they get things like insulin. You talk about diabetics, and these cows will be insulin resistant. So some of you all are experienced with that, I'm sure. We give B vitamins, we give oral energy, and we do things like steroids, and a lot of that will help to reduce the milk production temporarily so she can catch up. So all these treatments become quite detailed, and again, it's more of an oversight today, but we've diagnosed it, we've replaced it, and we've done a great job, and now she's standing up. Okay, wonderful. Yay, we're done, right? No. Why? Because she, for whatever reason, still won't eat well. She doesn't have a really large fever. She's still a little shaky, but she moves around well. And bottom line is she is not producing any milk whatsoever. So, have we fixed her? Not yet. Okay, so we've recognized some potential sequela to what we think might be her primary problem. Okay, so as we see response to therapy, the one thing that really, and whether that's any problem you're trying to solve, is once you see a little response, you always go back and you reassess. Okay, am I getting through the entire picture or not? Okay, so we're not over the hump yet. There's still something wrong with her. She's up and she looks good. So back to our physical exam, back to our drawing board. And as we're doing our thermometer, and we're listening to her lungs and her heart and palpating all over for anything that's swollen, one thing that we do with these cows is we put the bell of our stethoscope on them, and we take our middle and finger and thumb, and we just thump them, and I'll show you that here in just a second. Okay, but that's called percussion. And the noise we hear a weird ping. And so this ping noise, I'm gonna try to play it for you here in a second, but it sounds as if you guys were to take a basketball and you put it up to your ear and you thunk it really hard, like that. You'll hear the thump, and then you'll hear this ding, ding, that pings off of that. Okay, and that is a ping noise that we hear with this cow, and it sounds just like as if there might be a basketball in her belly. Now we know she can't eat it. Okay, so what else is going to be pinging in that? Cows eat a lot of stuff and put it in their rumen, but not basketballs. All right, so we hear that, and we try to take the next step as to trying to figure out what it is. Now, I'm hoping that maybe one of you guys or somebody can give me a thumbs up here to see if you can hear this noise. It worked in one setting, so let me see if I can do this again. Excellent. I'm going to play this a few times then. Okay, so every time you're hearing that ping noise, it's as she is one more time. Okay, so every time you hear that ping, she is taking her finger and she's thumping it, and her stethoscope is here, and she hears that noise right underneath there. Okay, so I have given this lecture before, and there may be some others around, but what could be in there? Is there a basketball in her rumen or not? Okay, remember on the left side of this cow, if we go behind her ribs and her belly, the whole left side is going to be rumen. So here's her lungs, but remember this rumen, okay, her first compartment essentially occupies the entire left side of this cow, okay, and it may ping, but it doesn't. So we're hearing right in this region, we're hearing this basketball. Okay, if we take that slide away and we wipe that off, on the other side of that rumen is the rest of her intestinal tract and her other stomachs, so her forestomach. So remember, we're talking about a ruminant here, and the ruminants in general are defined as an even-toed ungulate animal that chews a cud and regurgitates it from its rumen. Okay, that's the main first compartment. And somebody will say, well, what is a ruminant? Does a ruminant have four stomachs? And that sometimes is the that is sometimes the answer to the quiz question whenever we talk about that kind of shifted around whenever we talk about ruminants in general, but there's really not four stomachs. Okay, what we're hearing on this cow, okay, is between that rumen, okay, there's something in there, okay, and there's several things that can make that ping. And usually what we have is we have essentially a piece of stomach, or one of the stomachs, that shifts to the other side, and it's under pressure now, and we've got fluid in it and we've got gas. And so if we think about that basketball that you can hear percussing between that rumen, okay, oops, darn this darn thing. Between that rumen and these ribs, there's something lying between there, okay? And what has happened is a portion of her forestomach is coming to the other side, okay? So we're pussing, we're pinging, and what it is, it turns out to be her abomasum that drifts to the left side of her abdomen, okay? The clinical signs of this, okay, are vague, kind of clinical picture, poor milk production, which she has. Oftentimes they don't want to eat well while she's trying to make milk, and so they get ketotic. They don't want to eat well, and they sometimes get the milk fever. Sometimes the milk fever possibly has led to this displacement of her abomasum. It comes to the other side. She's also doing something where they, I think cows are smarter than people let on or believe, and I think that they know that they don't want to eat much grain because it upsets their stomach more. It makes more gas, okay? It's like a bad burrito. You may want to eat a salad instead, kind of help that go on through. And so they tend to eat roughage more often. And so that's kind of what she's doing. She's eating a lot of hay, but not grain. But that's not really good for milk production. So that she has all these clinical signs. She has this ping on the other side. And other things may complicate this, making them sick, but oftentimes it's a pretty straightforward disease. So back up a little bit. So do the ruminants have four stomachs? No, not really. They really only have one actual stomach. What they have in general is 4 compartments of that. So they have they are rumen, which is the large vat on the left side. They have a reticulum that is sort of a filtering portion of that rumen. We have an omasum, which some would call the 3rd compartment, that essentially takes away most of the fluid from the rumen and dries it out and pushes it on over into the abomasum here. So the abomasum is the actual true stomach, like you and I would think about, and it has the digestive enzymes. It has the absorptive capacity of most of those nutrients. Okay, but most of it is processed initially by these first 3 compartments. So really only one stomach, and this little bugger over here is a little bit mobile. Okay, so it can tend to drift. And if we look at this this picture here on the right side, say our esophagus is coming in here, the reticulum, the rumen, remember, is over there on the left side. The omasum is between that, dries it out, and then drops it into this abomasum. And this abomasum should lie right over here on the left side of that. Okay, but for some reason it went away from here and went over to the left side. Okay, and as it drifts up, okay, as you start to see this disappear, so this would be normal rumen. The spleen on a cow actually lies on the rumen over here. Reticulum down here, omasum you can't see, and then the abomasum is drifting up here to be between the ribs and on top of the rumen. Okay, so if you can imagine this, and I'll show you another view of it here in a second. Okay, so now this is really under a lot of pressure. There's fluid that is stuck in it because it really doesn't move through very well. You can imagine if you had something like that, you would have a little difficulty getting that stuff out. And it's under pressure. And so it's just like a basketball. So now when you thump on this, you hear this resonating ping on the other side. Okay, and that's called a left displaced abomasum, or an LDA for short. We look at it from the right side. Okay, on this right side, this is all fat, but the abomasum lies just to the right of midline on this side. And gallbladder and liver, this is the omasum that's sort of hidden under there, and reticulum being there. But what you'll see is it starts to displace from its normal position. Okay, it's the outflow, but then it's just drifting away to the opposite side. So I'm going to say, so what causes that? Okay, and quite honestly, we have risk factors, but we don't have an exact cause. Risk factors being some diet, some decreases in calcium. Calcium actually makes that squeeze and has some tone in it, so that gets kind of flaccid. Some of the grains, some of the gases that build up in that become somewhat of a risk factor in that this could potentially fill with air, just like a helium balloon, and kind of drift to the other side. We do notice that some of the fiber content, so a whole bunch of different things go into why this develops. And in the bottom line is it could be even just genetics. You know, why do I not see this more commonly in beef cattle? I don't know. But for whatever reason, it does happen, and it does drift to the other side. And the next thing is we have to fix it. Okay, so she is not going to eat worth a darn while this abomasum is sitting over here on the other side. Okay, so hopefully we can get her back to eating, but we've got to put it back to the other side. And a couple of ways to do that. Okay, some where we can actually lay the cow down with some ropes and maybe some sedation and roll her around until we can get it over to the other side. That rarely works. There's other things that can happen. Then we have about, I think I've counted up at one time, 8 or 9 different surgical opportunities to, or surgical approaches to replacing this abomasum. So we have to replace it, and then we have to hold it over there. So one reason the rolling thing doesn't work and then let her stand back up is that it tends to not stay where it's supposed to be. So we can either come here through the right side of this cow, the left side of the cow, through the bottom side of the cow to do this. What's really nice about cattle is that we do a local anesthetic that essentially numbs the entire right flank or left flank or other with lidocaine. So she's completely unaware that we have made an incision in that side and reached on the inside. What you also identify or learn when you're in school is that the nerve endings that are on the bowel are not sharp pain. So she might feel a little pressure, but nothing that's painful. So we numb this and we can do this standing. So it's not a major surgery, and thank goodness, because it's one of the more common things that we potentially do. So other things to do. So here's another animation. And these are wonderful videos out of University of Montreal, and they do some unbelievable work up there, but it shows how we do this. So this left, the right flank of this cow, this is this one, okay, where we've numbed this whole skin on this side. Okay, let's back up just a little bit. So we've numbed this entire region on her flank, okay, and we're going to be able to go right inside of there, okay. Learned a lot of anatomy early on, so we know that we can go around to the opposite side, over the top of the rumen, or back down underneath there, and we place a needle with a tube on it, and oftentimes a vacuum. And so I'm going to insert this needle into here, I'm going to turn on the vacuum, and I'm going to take out the air that is in this abomasum. So let it go down, the air starts to drift back down, until we can get as much of that air out as possible. Remember, this is going to have a fair bit of fluid in it as well. Okay, so we've repositioned it to this point. Usually come back out, take our needle and tubing away, and then go back in and lift it up. Okay, so then we're back here on the right side, and we're going to lift it up till we have this fat, and we have this portion of this abomasum on the other side. Okay, so we've repositioned it. That's great. Now we have to stick it or fix it in position on this side. And Dr. Word for that, a definition of pexy. Okay, this is a suffix word portion of most words, and we follow abomasum with pexy or omentum with pexy. That would indicate that we are then going to fix this abomasum onto the other side. Okay, so we identify it, put it back into the abdomen, and we suture these portions to this part of this skin and muscle. And what that's going to do is it's going to anchor it and not allow it to drift to the other side again, which is a fun surgery. It's something that if you are going to be a veterinarian and do any dairy practice, it's something that you could potentially do several times a week. Okay. If you get involved with those practices. Okay, so that's the right side. Okay, this is what we did on her. It's the most common one. It's one I like because I can actually do a lot of exploration of her while we're doing that. There's other options. So if you look through, this is on the left flank of this cow. This is her rumen, and this is showing that abomasum that's between there. We can actually come in on this side and attach sutures that come down to the bottom and out. Okay. So abomasum, rumen, we place some sutures in that, and then we push them down to the opposite side, and somebody will pull out through the bottom. So we take a needle and come out. So that essentially pexies or anchors the abomasum to the lower right portion of the abdomen in normal position. Okay, that's a preferred method for some, and we have different reasons why we might do that. And then we do the ventral one. Sometimes we lay them on their back and we make an approach through the bottom half, and we identify it and we suture it to there as well. So another method. Okay, one of the really innovative methods for attaching this abomasum to the ventral portion of the body wall is no surgery at all. Actually, it's a local anesthetic, and then you use your stethoscope again and you percuss and thump until you hear that ping underneath your position that you want to anchor this, and you have, again, local numbing agent or anesthetic lidocaine in this region. You punch through that, and you essentially put these toggles through there, and then you pull them back up. And if you can picture what this is going to do as it traverses through this trocar is going to get down through into the abomasum. It's going to widen sideways. You're going to pull this out and pull your string up, and it's going to then hold it down. This is probably one of the most straightforward, easiest methods to do this. Very quick, not without complications. So it's not the one that we would do all the time, but this is an innovative way that a very large proportion of dairies this day and age do this procedure, and it gets the cow fixed promptly, and it gets her back to milking quickly. And that's called a ventral blind toggle abomasopexy. There are other ways. So again, that is only 4 different methods. There's large suture methods. There's over in Europe, I've seen where they do it with a laparoscope. So you come in with a scope on either side, and you find the abomasum and you suture it and you push it down to the opposite side. A lot of really, really neat opportunities. Why is there so many methods? Some preference, some situational applications, okay, for the times of pregnancy. Some is facilities, okay, so who's able to actually roll a cow up on their back, and other just kind of unique ways to do it. So a whole bunch of different ways, and there's reasons why it's done that way, but a whole bunch of fun things to do, okay? Finally, so you know that you've hit your goal with success. Usually when a cow will start eating just about anything that's in front of her. And I have seen this surgery work so fast in that by the time we reposition the abomasum to the proper side, the cow is already starting to chew her cud, starting to perk up, starting to look really good. By the time we finish sewing up the skin, put her back in her stall, they're ready to eat. Okay, so it can be quickly. Depends on how long it takes to get it diagnosed. So as veterinarians, we really want to try to stay on top of our reassessment of our patient and making changes and discussions with our client as we go. So back she goes. Okay, another important part of agricultural animal management is that we're going to make sure that this cow has taken the time to eliminate any of the potential medications that we might have used. So lidocaine, for example, we may have used some local sedatives. All of those things have a very strict line, okay, and so the FDA, and we have reasons that we actually have, we know, okay, we do not want these drugs to enter the food chain at all, and that milk is included. So we have set withdrawal times that this milk cannot be put into common milk tanks or milk bulk tanks for human consumption. So she's held off the line, she continues to eat and recover, but she's not, her milk is not used until it's safe to drink. Okay, so we be sure that we follow those, then it's back to work. And most of these cows will recover fine if it's diagnosed rapidly. If not, we may have some complications afterwards. And really all we have to do at that point in time is remove her stitches in her skin, monitor for any signs of infection or other, and move on. So it's one of those very common diseases, very fun surgical things that we get to do on the veterinary side, and we get to go from there. So a successful one and a fun disease to find, okay? So I'm gonna stop just for a second. I have another, because I'm just gonna say, well, how come they can't go to the right side? And I will say, I have a couple of slides on that here just a second. But like I mentioned a little earlier, this is sort of an overview, a really high overview of what's going on with these cases. So real quickly, are there any questions or anything in the chat so far regarding this disease? Try to see if I can see.
None that I can see so far.
None so far? That's fine. Okay, quickly, because we're still got about 5 or 10 minutes here. So somebody say, well, it goes to the left side. Can it go to the right side? Okay, I mentioned the left displacement is often fairly benign. Okay, it's something we want to get on promptly so the cow feels better and eats more. But can it go to the right? And so the right side, we learn really quickly, is an emergency situation. Okay, so this abomasum, low right side, instead of taking off and going to the other side on that, we will note that she will, essentially just twist. So this portion of her abomasum starts to drift up here on the right side of this cow. Okay. All right. And at this point, we're still okay. Okay, but your basketball or your ping is going to be heard on the right side. We're still okay. Food can still come in here, out here, and out. It's not much different than a displacement on the left side, right? But if our client has told me over the phone, I have a cow that's not eating well, maybe she's ketotic, maybe she's had some other things going on, but I hear a ping on the right side, that is a priority call. That's something that we will take great measure to get to promptly. And the reason being is that this right abomasum displacement can quickly turn into what we call a volvulus. So it can't do this on the left side, but similar to the displacement, okay, just like we had before. Just like we had before, it displaces and rotates up to this side, okay? So it drifts up here, but what you'll see to happen now is that this portion, the outflow of her abomasum or the pylorus that normally goes downstream, starts to twist this direction, okay? So it becomes a volvulus. And what happens with these is as it twists, and nothing can get out at this point. So gas continues to build, pressure continues to build, fluid continues to sequester in the abomasum. Okay, and what happens at this point is blood flow becomes compromised. Okay, things become quite severe in this cow, and she really gets shocky, and things can go downhill really promptly. To give you a little example, we oftentimes have a little tire gauge measure on these whenever we do the surgery to correct these, and I put a tire gauge on the end of that tubing with the gas, the vacuum, and this can actually reach 30 to 35 psi. So if you think about your tire in your car and that kind of pressure in your stomach, you can only imagine what that feels like. So really sick really quickly. And so these are things that we don't want to have happen. And it's really important to get to those. This is an emergency surgery. And the replacement is pretty similar. We come into here and we just reposition it back into place, and then we pexy it back into position. But certainly a lot more severe condition, and something that we want to identify promptly. So left displacements, we have all the same potential risk factors for these. Okay, so rights are about the same risk factors. The problem is the sequela or the outcomes are more severe, and so we want to identify those promptly. So again, during our physical exam, during our assessment of the case, we can figure that out. Okay, so with that, are there any questions? So you guys think we kind of like to run? Me and some of my colleagues here, we actually did a race. My wife said I look like I'm running from a bear, and so I said, I guess I do. But when you get, hope you guys have some fun. If not, we can ask some other questions. So I hope there's something. Hope somebody has anybody been on with a veterinarian and seen this in the past? Boy, quiet group.
It looks like we've got a question from Nicholas Woodworth. He says, can this present in other animals?
Great. So the question is, can this displacement of an abomasum present in other animals? I have not seen it in other species, but we will always present this in cases of adult cows. We do see it in young calves. So it's one of those situations where I see in young dairy calves. We see it in young beef calves, actually. But for some reason, even in the dairy goat side, I have not seen a displacement in the abomasum. And that's why we think there's got to be something about anatomical development in these cows, as well as maybe some genetics that predispose it to it. You know, so really not a lot in other species. Yeah, in the llamas and alpacas and others, they don't have an abomasum, so they don't do it. But we've tried, you know, we've wondered on occasion, but I have not seen it in any other species other than cows. Yeah, no. But I did mention it's not as common in beef, but we do see it occasionally. Great. So I see another question is that any cases where the cow has had something rather other asking if there's something other that would happen that you misinterpreted it. So could other things ping in there? Yes. So what can potentially ping in there is we could have fluid underneath the peritoneum. We have infection. So one thing that will cause a similar ping on the other side is hardware disease. So we'll see that occasionally. We can have peritonitis within it. Then, as we start talking about our physical exam a lot more, we have a whole bunch of other portions of intestine. So we've got a cecum in there, which is like your appendix, but a cow's is about the size of a tube sock. We've got a bunch of small intestine that can ping. And when we hear those back here a little bit further, we actually then do a rectal exam and see if we can identify those as well. So yes, but have we been fooled? Sure. Oftentimes it's the beef cow that has the left-sided ping that we go in and we find a hardware disease or other. But the exploratory portion of that exam is as much confirmation that we get to do in cattle as well. So I hope that's kind of what we're asking about. Yeah.
Sophia, you're welcome to unmute yourself and say whether or not that answered your question or if you had a follow-up.
No, that answered my question.
Okay, great. Are there other questions that you would like to ask Dr. Meisner?
So one thing that I mentioned was the surgeries, they're fun. The investigation of the problem and the diagnosis and the problem solving are great fun. But this is a condition that, whether it be left or right displacements, is something that we really try to prevent, because the cost on a surgery like this might end up costing the client just for the surgery alone. And you guys are probably laugh, but it's usually going to cost around $250 to $300, okay, just for the surgery. What we're not figuring into that factor for an agricultural animal is that we've also got lost milk production. Okay, so I said she's not been milking well for days. We also have potential other complications like infection in her uterus, mastitis, and other diseases that add up. And so some of these diseases are this single case of a displaced abomasum may end up costing this dairy farmer $800 to $1,000 per case. And so if you can imagine him trying to make this work and have milk prices such that it's going to pay for those diseases, it's not very cost effective. And so that's why some of those easier procedures have been developed. And it's some of those things that we actually have herdsmen do those procedures, but it's really important to try to prevent it. Okay, and so when we see these happen, we oftentimes see it during changes in swings in weather. We will see it with variation in feed components. So if you guys have fed dairy cows, you'll start to see how those components are mixed and put into a bunk. And so we really want to be sure that it's a consistent feed. We want to make sure that their calcium levels are normal, that the balances are normal going into it, that the weights going into the mixer are correct. So a whole bunch of preventive measures start becoming part of our picture, because I really want to not, as much fun as that surgery is, it's one of those for my client to have him or her have the best outcome and the best productivity for the dairy and to stay in business, keep me employed. I really try to prevent it. Okay, so that's part of it. And there's a large flow chart to look through to kind of go back and identify it. So again, it's hard to do it, but we really want to prevent these as much as anything.
We have another question, Dr. Meisner. It's about the whole One Health aspect of it. What would happen if the anesthetic or any type of medications that you're administering, if those are residual in the milk of the cow? Could you address that, please?
Absolutely. And so there is a whole large portion of checks and balances that happen before that cow's milk's allowed to go into the tank. Okay. Very sensitive tests go into it to identify her cow side. So the client or the dairy, the milkers and others can test that milk directly to be sure that there's no residual drug in that that's going to potentially go into the tank. Okay, so they can do that. We have well-known research to know when that elimination is going to be such that there's going to be low levels. So a lot of research goes into how long she has to stay out of the milking part of it before she's milked. So we have first research, 2, we have cow side tests. Next thing is going to happen is that the whole bulk tank will be tested as well. So if there was a chance that that milk somehow was a little bit longer, it didn't get tested and got into the tank, that will be tested before it's taken as well. So it's really hard to do, and the tests now are so sensitive. Now, say one was to test positive. If it's tested positive in a bulk tank, that whole tank is dumped. So there's no way to clean it at that point in time. It is eliminated. Okay. Also, if we find the regulatory agencies will also, if test positive, will investigate the veterinarian as well as the client, and you will have a residue avoidance red flag against you at least once. And so these things go into a check. And so one thing that we are very careful to do as a veterinarian is to be sure that we document these things and make sure that the client is not going to have a misstep. These cows are also, they will be, most dairy producers will identify these cows with an ankle bracelet or an ear tag. Some of them are even electronic. So once she's been treated, it's put into a computer system so that she's identified before that ever happens. So if it ever does get in though, that tank is emptied and they're all tested. So very, very, very unlikely. Hope that answers the question.
Ashlyn, you're welcome to unmute if it did not answer your questions. Seems like there are quite a few, there's quite a system of checks and balances to make sure that the milk that you get from the store has no contaminants. Oh, here's one from Nicholas Woodworth. And Nicholas, would you like to unmute yourself and read that question for us? Sounds like he may have trouble getting the mute button. He says, is there anything that dairy farmers can do to prevent their cows from developing LDA or RDA?
Yeah, and so again, if we're trying to prevent it, we're going to look at a whole bunch of reasons why that might have happened. We've seen it be as simple as the scales of the feed mixer be off. And so say they are putting in a larger amount of corn to this mix than they want to, okay, and they think they're doing okay, but the weight on the scale is off. So we can look at the equipment, one, make sure that that's okay. We can look at the source of what's coming in. So sometimes it's the quality of fiber of the hay. You know, it could be really poor quality or really good quality hay. You'll notice that almost all of the dairies, the bigger ones nowadays, will actually analyze their feed. So they'll take a sample of feed and they will send it off to a lab and it will give them a whole list of components. So we can look at that feed analysis and say, oh my gosh, this dietary fiber portion or concentration is off in this batch of feed. So we can adjust that for the next one. Maybe it's the time of feeding. So, you know, one thing that we always talk about is cows don't understand daylight savings time. And so whenever we're feeding at the same time of day, but then all of a sudden the time changes and you're trying to feed at the same time on the clock, doesn't really work too well for cows and actually can upset them a little bit. So we really have to be sure that we're not changing up something as simple as that. And then in the end, you know, some of them are just going to happen. Okay, so there's just going to be some cows for whatever reason that just develop it. And so we're trying to reduce the overall number. We really start looking at prevention when we see large numbers starting to happen. So I get one cow in once every 6 months, probably not anything I'm going to identify. But we get 3 in a week. That's a concern. Yeah.
I don't see any other questions, but I would love for you to elucidate how you as a student went from high school to college. What made you successful?
So how did I go from high school to college? So I came from a really small town in northeastern New Mexico. And I was actually the first one in my family, immediate family, to go to college. My parents were both went through trade schools. And so now I was a little unique in that I really loved to play baseball. I really thought I was going to be one of the next Kansas City Royals. Okay, so I was decent, and so I was able to land a college position with the little sports with the junior college. But I always knew that I was wanted to go and study science. So I've always liked science. And so as I was in junior college playing baseball, and I realized that I really wasn't as fast as I thought I was, it was time to buckle down and start getting into the science part of that I really enjoyed. And so at that point in time, I then started on an Associate of Science degree, moved on to a 4-year college at New Mexico State, continued in animal science. In the rural portion of New Mexico where I was from, I spent a lot of time on beef ranches with horses and beef cattle. And my next plan was to do an animal science degree and probably go back into nutrition or other. I even thought about advanced degrees there, but it kept coming around to the veterinary side of it as I was going through college, and I really enjoyed that portion. I enjoyed the science, I enjoyed the species, I enjoyed the troubles and the problems to try to solve. I got to work with some veterinarians and see what kind of things they could do. And so at that point in time, you just start going for it. And I moved on to applying for veterinary school from then on. But I always knew that I really liked the science portion of it, and I just really wanted to keep going as far as I could. And I missed out on the speed to get to play with Hosmer for a few years, but the way it went.
It's always nice to add a personal side to something that's so involved with veterinary medicine. We've got a question from Sophia Schultz, and she asked, what would you suggest doing if you are really interested in becoming a veterinarian between middle school and high school?
Start volunteering if you can. I mean, at that portion, at that period in time, as you're in your education, you can start really getting to experience what a veterinarian really is. And I think being able to volunteer and get some actual experience in a veterinary clinic with a veterinarian and maybe more than one, because not everyone is the same. So I think getting your experience is very important. You're gonna, if you're that motivated, you're going to be staying on top of your studies. You're going to be staying on top of your reading and your science portion of that. But I think getting the experience early on is really important, because at that period in time, you start to decide what you really want to do, and it may be one of those where you can at least kind of get an early experience that way. So if you can, the biggest thing is getting experience, as I think, and it's not easy to get experiences. So the sooner you can start trying to get that, the better. And hopefully it works that way. And many are willing to shadow and do some things that can get you in. And maybe that will work into a high school job later on, and then you get the real experiences.
Okay, thank you.
Probably talking to neighbors, relatives, anybody that you know knows a veterinarian, or any of the animal related careers. Because
Shelters.
you never know, you, as you said, Dr. Meister, you really thought you were going to be a small animal vet.
Yeah.
And until you actually experience or explore the other possibilities that are related to those studies, you may not refine. In fact, your career may not have even been created yet.
Right.
So, I would encourage students to really check out all the possibilities.
Shelters, you know, so you can work at, I mean, there's always, shelters are always needing volunteers. So you can get to, and I think that that type of experience is invaluable, is because then you start recognizing animal habits, animal personalities, animal behaviors, which are things that are hard to teach in a book. You really can't do that. But those are things that you're really impressionable at that stage that you can start picking up early on. And so shelters, zoos, you name it. There's just lots of opportunities, farms, ranches, those kind of things as well.
Now, Sophia went further and she says, would it help if I took my dog to the vet and asked questions? Yes.
Yeah.
Always ask questions.
Absolutely. Go with questions, you know, have questions ahead of time. And yeah, that's just part of our job. So it's that we like to do.
Okay, well, it looks like we are about to, I want to be respectful of Dr. Meisner's time and your time as a participant. If there are further questions, you can always send them to me at K-State Olathe, MS Nowak. I'll put it in the chat box. And you can email me there and I will forward it on to Dr. Meisner. But I want to thank Dr. Meisner for taking time out of your busy schedule with your students there at K-State and with your busy life as you know, a family member. It's hard to balance everything, but I appreciate you taking your time, and we certainly have been enlightened a bit about bovine surgery.
Great. Now it's fun. I always enjoy these. These are a blast, and it's part of our day. And I saw my students were on for a little while, so hopefully they learned something too.
Great to have you. Have a wonderful week.
You too. Enjoyed it.
Bye, everyone.